First of all, I would like to thank the organizer for organizing this important session related to World Epilepsy Day. Now, my topic is WHO Intersectoral Global Action Plan on Epilepsy and other neurological disorders, and its relevance for epilepsy care in Pakistan. Successful collaboration has arisen in the last many years related to neurological disorders and WHO collaboration, and there are some of the publications related to this collaboration. And optimizing brain health, I think, is a very important topic across the life course. And this was a position paper launched by WHO. And this is a very interesting information and read related to brain health across the globe. Intersectoral Global Action Plan has a vision of the value of brain health, which is protected and promoted across life course, and neurological disorders should be prevented, it must be diagnosed and treated, and premature mortality and morbidity must be avoided. People affected by neurological disorders and their carers attain the highest possible level of health with equal rights, opportunity, respect, and autonomy. So it has clear goals. The most important goals are to reduce the stigma, impact, and burden of neurological diseases, especially epileptic disorders or epilepsy, including associated mortality, morbidity, and disability, and to improve the quality of life for people with neurological disorders, their carers, and their families. It has guiding principles which is related to primary health coverage and universal health coverage, integrated approach to life across life course, and basically it is based on evidence-based informed policy and practice, and intersectoral action and collaboration, and empowerment and involvement of persons with neurological disorders and their carers with gender equity and human rights. It has a bunch of strategic objectives. The main objective is to raise prioritization and strength of governance, strengthen governance, and to provide effective, timely, and responsive diagnosis, treatment, and care, to implement strategies for promotion and prevention, to foster research and innovation, and to strengthen the public health approach to epilepsy. So, in prioritization, advocacy is the most important aspect, and it also includes policy, plans, and legislation, and financing. In diagnosis, the care pathways are important, then medicine, diagnostics, and other healthcare products, health workers' capacity, training, and support, and carer support is important. Then promoting the brain health, especially healthy behavior across life course, infection control, prevention of head and spinal trauma, reducing environmental risk, and promotion of optimal brain development in children and adolescents. And we do it by investing in research and data and information systems. And the public health approach is extremely important, especially related to epilepsy, which is highlighted in this Intersectoral Global Action Plan. So access to service for epilepsy, engagement and support for people with epilepsy, and epilepsy as an entry point for the healthcare system. So these are 10 global targets related to World Health Organization Intersectoral Global Action Plan. And out of these targets, advocacy, diagnosis, and training and capacity building, especially in research and public health approach to epilepsy. And that includes advocacy for available and affordable anti-seizure medications, conduct implementation research and dissemination to strengthen epilepsy services, support public education about epilepsy for community health workers and members of community, and lobby policy makers to integrate care for comorbidities in epilepsy treatment. So this is an important document, and an important aspect of this document is collaboration between WHO and non-government organizations. So WHO recognizes 4 groups of non-state actors. NGOs are important, like Neurology Awareness and Research Foundation is a non-governmental organization working to promote neurological research and education and training. Private sector entities, philanthropic foundations, and academic institutions. So these organizations, they work in collaboration under the principles outlined by WHO for these non-state actors to promote brain health and neurological health. And this is the framework for engagement with non-state actors. So the steps taken by WHO are to find and verify relevant information on a non-state actor and to reach a clear understanding of its profile and risk assessment. Formal engagement is important. Official relations of these WHO with these organizations are important, and WHO has enabled non-state actors for global health. For example, for epilepsy, they are collaborating with International League Against Epilepsy, World Federation of Neurology, International Bureau of Epilepsy, Alzheimer's Disease International. These are some of the organizations WHO is collaborating to improve neurological health and neurological care. So other engagement is attendance at meetings and consultations, co-development or contribution to WHO technical products, dissemination of WHO technical products and messaging, and advocacy events, especially Global Health Days. So today we are going to celebrate International World Epilepsy Day, and this is also a part of the WHO action planning for improving neurological care. Official relationship is important, and for WHO, for non-state actors and other organizations which are going to be working with the World Health Organization. Now, this implementation of intersectoral global plan is important, and that was decided by World Health Assembly. The main actions include leadership and advocacy training, production of technical products, country action, research and data, and collaboration. So these are some of the important aspects. Leadership and advocacy is going to be the most important aspect of WHO action plan, especially for epilepsy treatment and management. This is important part of global health agenda. And basically, we want to provide a convening platform for generating and leveraging evidence-based information and best practices to inform multi-sectoral action. It should affect policies, plans, and legislation, and involvement of people with neurological disorders. This is an important aspect of improving neurological care across globe, is to involve people with neurological disorders, patients, their family members, their carers, and patient support organizations. So they should be able to understand and advocate for realization of human rights and conventions, policies, laws, and services based on their needs and preferences, and increase resource allocation for neurological disorders and supporting evidence-based budgeting that minimizes out-of-pocket expenses. So this is an advocacy and policy making which has to be done at a country level or province level to improve neurological care. WHO has done a lot of work in this area, especially global position papers, so World Mental Health Report, epilepsy has been published by WHO, and this is a very good document. Epilepsy, a public health imperative. There is a brain health position paper. COVID-19, there are many publications, and with non-communicable diseases. So these are some of the publications by WHO targeting improving neurological care across globe. And what are the supporting evidences for the development or policies and plans? So WHO wants to develop a review, update, strengthen, and implement national and subnational policies, and this is a WHO mandate that has to be done by the countries, the ministries of health of countries and provinces, to develop a national policy related to neurological diseases, and it should be as a separate instrument for neurological diseases, and it should be done in consultation with people with neurological disorders, especially their carers and the stakeholders, and the neurology community. So this policy making is going to be very important for WHO action plan. Some challenges in this area. I think the major challenge, which is again in Pakistan, is the lack of prioritization of neurological diseases in public health agenda. There's lack of awareness, there's a stigma among policymakers toward neurological disease, especially epilepsy. There's lack of among policymakers and people with conditions and strategies for working together. There's lack of coordination among different sectors related to healthcare, and there are legislations that are discriminatory towards people with neurological disorders. So these are some of the challenges which we have to address. And basically, to address these challenges, we need a strong advocacy, we need collaboration and integration, we need capacity building of the healthcare force, the doctors, the nurses, and the paramedics, and even the family members. And this should be considered an investment, not an expense. And the healthcare system should invest to address these challenges. There are technical products which are available, and these technical products could be used. Some of the WHO guidelines which are available, especially for WHO guidelines for management of infection, cognition, cognitive decline, dementia. So these are some of the WHO guidelines and principles, and technical products are available and should be developed in the countries. WHO has done standards and standard setting products that are not guidelines, but they are very helpful, especially related to Parkinson's diseases and other neurological diseases, and COVID. So these guidelines should be used for future care. Care pathways are important that should be developed by the local societies. Local guidelines like Pakistan Society of Neurology has published epilepsy guidelines throughout Pakistan, and we should look at the WHO essential medication list. Now, most of the anti-epileptic medications are part of WHO essential medications list, and these should be made available to all patients in Pakistan by the government sector hospitals, and government should make sure that these medications are available. We should have a state plan for healthcare worker capacity building, training, and support, and that includes curriculum development and training material, and forums for clinical exchange. And we should develop a plan for carer support, especially the family members of people who have neurological diseases or epileptic disorders. So these are WHO integration that, there are many neurological diseases, and we should understand a cross life course, and healthcare and social system, especially universal health coverage and primary health coverage, should be focusing on these neurological diseases. And WHO has mandated countries to make sure that they are able to address these kind of issues. Now, epilepsy burden in Pakistan is very high. 65 million epileptics across the globe, but we have 2.4 million in Pakistan, which is 9.99 per 1,000 people. It's more common in children, which is 14.6 per 1,000 children. More than 50,000 deaths per year related to epilepsy. It's more in younger than 30 years of age and more in rural areas. There are a lot of challenges related to epilepsy care in Pakistan. There's lack of awareness among public and misperceptions. Lack of awareness among physicians is a problem. Affordability of medicine, especially in the rural areas, and even availability of medication is an issue. There's lack of neurologists in countries, so there's only one neurologist for 10,000 epileptic patients, and no government support for epilepsy patients and its medication use. So these are some of the challenges. And the important thing in country action is basically a policy dialogue and strategic support. So these are two important aspects for country action. And this is the framework WHO has identified for country action. So there should be joint working teams working with the country office of the World Health Organization and the regional offices working with the ministries of health at the provincial level for improving neurological care. WHO has done some policy briefs and activities, especially related to dementia
and a special initiative for mental health, epilepsy projects, and framework for the service delivery in countries. For mental health, WHO has ensured that universal health coverage should be data collection from almost all centers throughout the Pakistan. So this data collection will be important for future neurological care and epilepsy care in Pakistan. Collaboration is extremely important, especially the collaboration between WHO and NGOs, between NGOs and NGOs and other partners. So Pakistan Society of Neurology is working with Neurology Awareness Foundation and educational institutions like Aga Khan University. And we hope that we will be collecting data from more than 70 centers from Pakistan. We'll be collaborating with them for research. NIH has provided funding for National Health Survey for neurological and psychiatric diseases in Pakistan, which is being done by Aga Khan University. So these are important collaborations for future interventions and future information. And that should work in the form of conferences, projects and initiatives, and consultation and advisory groups. And these collaborations will be important for future neurological care, especially epilepsy care. So other key diseases should be incorporated in this neurological care model and epilepsy care model, especially mental health is an important issue for epileptic patients. They do develop depression, anxiety, and a lot of social stigma. And it's an important part of non-communicable diseases. And this collaboration should be at a primary healthcare level, because there are only few neurologists in the country. So that can not provide care to all the epilepsy patients. So this care should be provided at a primary health care at the level of lady health visitors or lady health workers. Medicines should be available at all levels. Diagnostic facilities should be available for epilepsy patients and other neurology patients. And rehabilitation and recovery mechanisms should be in place. And we should also be able to work with public sectors for these patients for employment, social protection, and social care, and law provisions. So these collaborations will be important for future neurological care. This is editorial which we published in Journal of Neurological Sciences, which is a World Health Organization intersectoral global action plan for implications for Asian and African countries. So in conclusion, WHO IGAP is a major step forward for epilepsy care and neurological care across globe, and we should be able to implement this action plan in Pakistan to improve epilepsy care. This is a 10-year strategic plan with yearly benchmarks, and PSN should be collaborating with WHO Pakistan and National Health Services Ministry and even provincial ministries. And we should be focusing on awareness, advocacy, and guidelines, neurology workforce training programs, recruitment at all DHQ and THQ level. We should have a neurologist, and even if there are no neurologists, we should be able to train primary health physicians or internal medicine doctor to provide optimal care to epilepsy patients. Stroke and epilepsy care are two important areas identified by the World Health Organization. WSO certified stroke centers are going to be important, and epilepsy section in society is going to be very important. And we should be focusing on research, population-based strategies, and research and registries. So at the end, I would like to thank the organizers for providing opportunity for discussion of this important action plan. And I will be glad to take any answers if there are any questions or concerns to this presentation. Thank you very much.